Are you limping around with knee pain and you've been to the doctor, they did an x-ray, they told you it's old age, you have arthritis, and the only thing that can be done is you need to have a knee replacement? If that sounds like you are not alone. This is happening to many, many people who are in their 50s and 60s, and they're wondering if there is another option to surgery. I'm here to tell you today there is, although it is going to require a bit of work on your part, but we are going to talk about that all today in this video. Because the truth of the matter is, if you have been diagnosed with knee arthritis and told that you either need to have injections or surgery, you may be wondering if there are any other options, because you see the doctor or the surgeon, and the surgeon says that you need to have surgery and that there's not anything else you can do because knee arthritis cannot be changed. And although that's true, we cannot change the knee arthritis that has already occurred, chances are that we might actually be able to change the pain. And the truth of the matter is, if we could change the pain, get you back to walking without a limp and doing all the activities you love, would you be willing to give up the surgery then? I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and I believe that movement is life and you deserve both. All right, before we go down the rabbit hole, let's back up a little bit and talk about what is knee osteoarthritis. So knee osteoarthritis is a wear and tear that happens in the knee joints that is common nowadays with aging. I want to point out that just because it's common does not mean it needs to be surgical or that it's the way your body is designed. You see, the knee joint is lined with cartilage, and that's like a thick, spongy substance, and it's supposed to help with shock absorption and also help the knee to be able to glide appropriately. However, as we age and we become more sedentary, and we may even be weekend warriors in that we sit all week during work and then we go and do all the things on the weekend, this can lead to an abnormal wearing and tearing on the joints because they're not moving normally due to our lack of activity or our increased activity. So what the body does about that is it lays down bone because it says there's something that's going on that's not correct here. And that is actually what the knee osteoarthritis is abnormal bony formation in the joint. And this can lead to a narrowing of the joint space, and it can also lead to inflammation. So inflammation may cause the pain. It also may cause a lack of motion in the joint. And so then you're limping along, your joint is not moving correctly. What's going to happen? You're going to get more osteoarthritis building up over time, which is going to further narrow the joint, which further causes you to limp, more inflammation, more osteoarthritis. So some people wonder, like, how did I get to bone on bone? This is the cycle that you went through. The truth of the matter is that bone on bone osteoarthritis does not occur overnight. It occurs over years. It's just that people don't become aware of it until they actually sense the pain, which takes them to the doctor, which causes them to get the x-ray, which shows the osteoarthritis. I see this most commonly in patients who have been involved in car accidents. So they may have been in a car accident and their knees hit the dashboard or their knees hit something, so they ended up having an x-ray on the knees. And the doctor says, well, there's osteoarthritis, or there's bone on bone, or there's arthritis in the knee, but that wasn't caused by the accident. And patients are really confused because, of course, they didn't know about this osteoarthritis or the arthritis or bone on bone or anything like that before the accident. They also didn't have knee pain before the accident. So now the doctor says, well, your arthritis was not caused by the accident, which is true, by the way, because arthritis takes years and years to build and form. But the patient also did not have pain the day before the accident. So what's going on here? What's happening is that they've had this arthritis, they've had these abnormal biomechanics, all of these things have added up over time, but did not reach the threshold to actually become painful until you added an acute injury. So that's a recent injury that just happened. In this case, it's the car accident. Now, all of a sudden, there's the inflammation is up in the joint because of the car accident. Now they have a perception of that pain and inflammation that may be caused by the arthritis. However, it was aggravated by the car accident. So in this case, you would have a patient with knee osteoarthritis. That's the chronic issue, but it was not painful until the car accident, which is the acute issue. But people get super frustrated about this, and I get it, because the day before the car accident, your knees weren't painful, but now your knees are painful, and the doctor's saying, well, it's built up over time, and they get really frustrated because they feel like they're being really patronized or talked down to. So we have to have this discussion of the fact that, yes, you have this chronic condition, this knee osteoarthritis, that was aggravated by the acute issue, which is the car accident. The reason why I bring up this example, because you may not have been in a car accident, you may be like, I don't get what you're talking about. What I'm trying to explain to you here is that there's chronic issues, that's the osteoarthritis, but sometimes it doesn't become painful until there's an acute ignition switch, is what I call it. The other important part of that, though, to realize is that you can be suffering with osteoarthritis for years and not even know you have it. So what causes this osteoarthritis? Well, as I mentioned earlier, in general, people feel like it's a wear and tear type issue that occurs naturally with aging. I will say in our society today, it does occur for a lot of people. However, just because it happens commonly doesn't mean it's what's meant to happen. Our bodies are actually designed to heal themselves as long as everything's moving correctly. Many people suffered with previous knee injuries when they were younger that never completely healed, that maybe left a little bit of ligament instability or scar tissue, and then that's added up over time to cause this osteoarthritis. If we have excessive weight or excessive load on the joint, that can further aggravate knee pain and arthritis symptoms and create more of that bone-on-bone situation. And for some people, that long-term knee injury may have led to muscle imbalances or improper activation of different muscle groups that can further cause stress to the joint over years and decades. And of course, if you have that acute ignition switch or any kind of inflammation in the joint, that changes how the joint is moving, which decreases the lubrication in the joint and can lead to that osteoarthritis. And the truth of the matter is, I would say in the clinic, I don't see people who have one thing or two things. It's kind of a combination of things. I would say I usually see, I had knee problems when I was younger, plus they have some muscle imbalances, which may be caused by the knee problems when they were younger. And then maybe they've had a couple falls or car accidents or traumatic incidences, and they're aging, so they get into their 50s or 60s, and they feel like all of a sudden they have this knee pain. And I understand it is all of a sudden to you because you didn't have it yesterday or last week. However, really it's a situation where it's been gearing up over time. All of these things have kind of snowballed into having this knee osteoarthritis. So who is most affected? Most people don't know that they have bone-on-bone osteoarthritis, even though they're walking around with it, after the age of 50 or so. It seems that once we hit that 50-year age mark, everything starts to make itself a little bit more known. And of course, that increases over time as we hit our 60s and 70s. People who have a history of a previous knee injury are more likely to develop knee osteoarthritis, and especially if they've had a surgery previously. So many people end up having a meniscus injury or ACL injury or something like that when they're young, they're active, they're playing sports. They rehab from it, but their body doesn't fully rehab 100%. And this leads to kind of micro trauma or micro tears that occur over time. And then when they get into their 50s and 60s, this shows up as a knee osteoarthritis. Women, I'm looking at you. If you are postmenopausal, chances are good that you're starting to notice more joint achiness, and that can definitely affect the knees, especially, again, if you have that previous knee pain or knee surgery or knee injury in your past. And the truth of the matter is, it can affect anyone who has weak glutes, muscle imbalances, who's really, really sedentary. That will cause these knee problems to show up earlier than 50 potentially, which is why we're seeing even people in their 30s and 40s having partial knee replacements. So how do you know if your knee pain is actually knee osteoarthritis? 1, stiffness, especially in the morning or after sitting for a prolonged period of time. pain with walking, stairs, or prolonged standing. Swelling around the knee. 4, grinding or clicking sounds. Feeling of instability or weakness around the knee. And 6, you may have an x-ray that shows some narrowing in the joint, but the truth of the matter is your symptoms matter more than the x-ray. All right, so now you know if you have knee osteoarthritis, what are you going to do about it? Well, the first thing is you need to deal with any muscle imbalances. You need to strengthen the muscles that are weak and make sure you stretch out the ones that are tight. Now I know right now you're wanting me to say, which ones do I strengthen and which ones do I stretch? The truth of the matter is that's different for everybody. So a lot of people on the tubes of you will say you need to strengthen your quads. However, most commonly, it's not the quads that are weak, it's the quads that are tight. And when the quads are tight, they put compression through the kneecap or the patella that actually furthers the knee osteoarthritis. So I will say clinically, I very rarely have people strengthen the quads because most of the time that's not actually what they need. More often they need glute strengthening than quad strengthening. But the important thing is that you need to know what muscle imbalances are affecting you so that you can get the best results for yourself. I love low impact cardiovascular activity to help get those knees moving and gliding. So we're talking about walking, biking, swimming, those types of activities. So less aggravating, so not running and jumping type of activities, but things where you can get that joint moving normally. Now, again, I will say, if you look at the tubes of you, people are going to say, don't walk or don't bike or don't this or don't that. The truth of the matter is you can walk or you can bike or you can swim as long as it doesn't increase your inflammation and your pain. Everybody's different. Don't let somebody tell you that you can't walk because of your knee osteoarthritis if it doesn't make it worse. Now, what I will say is it may not necessarily hurt while you're doing the activity, but does it increase your inflammation and your pain after the activity? You have to analyze that too. So if you go for a 5-mile walk every day and 2 hours later your knees are puffed up and red and swollen and you can't move, you're hobbling around for the rest of the night, then friends, 5 miles is too long for you to walk. It's important that you listen to your body as opposed to what anybody on YouTube says. I do want you to be doing some gentle stretching exercises all the way through your lower body. So we're talking quads, hamstrings, calves. We want to keep all of those muscles that surround that knee joint nice and flexible. If you have increased weight that's putting increased stress on the joint, managing to lose that will help decrease that load. It is really, really important that you have a good posture and proper body mechanics while you're doing your activities of daily living. So that's really anything that you do regularly throughout the day, and it varies from person to person based on what you do around your house and what your preferred activities are, as well as what you do for work. But you want to make sure that you have really good knee biomechanics to make sure you're not putting too much load on your knees throughout the day. And everybody wants to know, what footwear should I be wearing, and should I be using some shock absorption pads? I will tell you, this morning I went for a run. I am in the middle of training for just a short, dumb long race this time. And so I had to wear my UFOs this morning because my feet are really starting to feel the miles that I'm putting on it with training. I'm starting to feel it in my knees. I need to give my body a break. So for today, I had to wear my UFOs to take some stress off of that. I am a big fan of making sure that your feet are properly supported. However, there's not a general recommendation for what that looks like for everybody because everybody's foot is different. But make sure that you're not walking around barefoot for long periods of time or flat-footed if you have knee pain, because you want to make sure that your foot is supported and can properly support your knee. And if your knee does flare up because maybe you do too much activity, or maybe it just happens because of your work or whatever, you definitely want to be using ice. Ice will help to decrease the inflammation just a little bit, but more importantly, it will help to decrease the pain for a short period of time so you can move around more normally. Now, how long do you need to ice for? I recommend you just ice for 3 to 5 minutes, but do it every hour if you're really, really inflamed. Now, I also know on the tubes of you and many doctors recommend putting heat on a knee that's swollen. And I will tell you that this does not make sense to me, but let me explain why. Heat draws blood flow to the area where you put the heat, right? That's the whole point. So if we put it over a joint that's swollen, we get more blood flow to that area, but the swelling indicates that it's a stagnant area. That means it's not moving things through very well. So we use heat to draw blood flow to that area, which means we get more swelling, not less swelling. So instead, while you have that acute swelling, make sure you're using ice for 3 to 5 minutes. You can use it up to every hour. It will help to decrease your pain and help you move better. If you're suffering with knee osteoarthritis and you have decided there is absolutely no way you are going to have surgery, you don't want to have injections because it can cause a myriad of other problems, and you're looking for a natural, non-invasive way to heal your knee osteoarthritis, then you are going to want to hear about regenerative medicine. What this is a series of machines that we use in the clinic to help decrease your inflammation, stimulate collagen production, and activate stem cells to help decrease your pain, get you moving better, get you strong again, and go back to all the activities that you love doing. It is especially amazing for chronic or moderate osteoarthritis that is not responding to traditional physical therapy. You see, for some people, there's so much swelling and there's so much inflammation going on in their joint that no matter what they do, they cannot move it normally. So that's where regenerative therapy comes in. It helps to remove that inflammation and restore that normal joint motion so your body can actually heal, which can delay the needs for any injections or surgery. Now, a lot of times people ask me, can regenerative therapy really keep you from getting surgery? Here's the key part of that answer. We cannot change the arthritis that is already formed. What we can do is improve how the joint is moving, decrease the inflammation, decrease the pain, which will help to decrease the formation of future arthritis. And for you, that may give you 2 years before you need surgery. It may give you 5 years or 10 years. But the earlier we start, the better the results are going to be and the longer they're going to last. So that leads to the question of, how do you know when to seek help? Well, if you've been suffering with knee pain for more than 2 weeks and you've tried the traditional techniques, the things you found on YouTube, so you've iced, you've done gentle motion, and it just doesn't seem to be getting better, and maybe it's even getting worse, I highly recommend you seek out help from a specialist who can figure out exactly what's going on with your knee osteoarthritis and get you on a plan to get you back to doing all the things you love. So that's what we had happen in the clinic recently. We had a lovely woman who we are going to call Jane, and she showed up with knee osteoarthritis, and she was one of those ones who had that chronic knee osteoarthritis, but it was aggravated by an accident. So you want to know where my car accident example came from? It came from her. So she had this chronic knee osteoarthritis. She was involved in this car accident. She hit her knee. She went to the doctor. They did x-rays. They told her she had knee osteoarthritis. She had to have a knee replacement. They said it didn't have anything to do with this car accident. And she was super frustrated because the day before the car accident, she didn't need to have knee surgery. Now, here's the really interesting thing. When they did the x-rays, they did them on both knees, but only one knee. But only her right knee had been impacted during the car accident, not her left knee. But they did the x-rays on both knees, and actually her left knee on x-ray looked way worse, way more bone on bone than her right knee. However, her right knee was the one that they recommended doing surgery on because that was the one that was painful, which got Jane to thinking, well, if my left knee is bone on bone and it's pain-free, then maybe there's a way we can get my right knee pain-free. Because Jane's super smart. So we had gotten her joint moving better with traditional manual physical therapy. We had gotten her pain down. However, she still wasn't able to get to those higher level activities that she wanted to be able to do. So then we did a 6-pack of Shockwave therapy. So she got to have all that love. She got to get the quads moving better. We put some direct energy into the joint. We dealt with the inflammation, and she was able to get back to all the things that she loved doing. She was able to go walking with her friends and even walk her dog. She could go walking on the beach, and she even felt confident returning to hiking, which she didn't think she would ever do. So, has Jane's knee healed? Will she never need surgery? Well, I can't tell you the end of that story, but I can tell you so far she hasn't needed surgery, and she is able to do everything she wants to do. And she was super happy to be able to delay that as long as possible because she does not want to have surgery and she refuses to do injections. If you've been told that a knee joint replacement is your only option for knee osteoarthritis and you live in the Maple Valley, Washington area, I am going to encourage you to book a discovery visit with us. Come down to the clinic. Let's talk about what's going on in your specific case. You can bring your x-rays, we'll check them out and see if you would be a good candidate for our regenerative medicine technology. Now, if you don't live in the Maple Valley area, but this sounds really, really interesting to you, I am going to drop a phone number in the description box below of someone that you can call to find a regenerative therapist near you. And if you're looking for some more help, I'm going to have you go check out this video over here.